this recording for the National Dialogue on Indigenous Data Plans is going to be hosted on the Spore Evidence Alliance website, which we will make sure goes out to you in the chat before you leave today. And we're going to be sending questions into the breakout rooms after our speakers. But right now, I again have the great honor of introducing Aaron Franks. 1 second, because there we go. Aaron is originally from Edmonton in Treaty 6 territory. Aaron is British, Northern European, and Métis descent with roots in the Anglo-Métis communities of St. Andrews, Manitoba, and Birch Hills, Saskatchewan. He is a member of the Manitoba Métis Federation and lives on unceded Algonquin territory in Ottawa with his family. Aaron is the Senior Research Manager, OCAP, and Information Governance at the First Nations Information Governance Center, FNIGC. He holds an MA in Social Justice and Equity Studies from Brock University and a PhD in Human Geography from the University of Glasgow. He has worked with the Center for Environmental Health Equity at the University of Manitoba and Queen's University, the Center for Indigenous Research Creation at Queen's University, SSHRC, and Universities Canada. He now belongs to a team dedicated to the education and applied research in First Nations principles of OCAP, information governance, and First Nations data sovereignty. Over to you, Aaron.
There we go. It looked like I didn't have permission to turn on my screen. Now I do. Wonderful. Thank you very much, Angela, for that introduction. And thank you, Elder Phillips, for those really wonderful words. So much to think about there and feel. I think this is a instance where communities, governance, Indigenous peoples' worldviews around their information as a collective asset encounter a lot of dry and institutional bureaucracies. We're looking at things like all sorts of policy initiatives with funding attached, policy and program development at the individual institution level, the need to develop strategies and for individual researchers, data management plans, but ultimately, communities' information and data is their collective asset together, and they owe it to future generations to steward that, and to our ancestors to steward it as well. So, and you really reminded me of that, the importance of that. So thank you. And thank you to Angela and all of the organizers for inviting me. I think we're going to keep it short and punchy. I don't have much time, and that's fine. I know you guys have workshops and discussion sessions you're going to hold. I'm going to share my screen now, and I'm going to share probably too many slides given the time that we have, but I will go fairly quickly through them, knowing that this is being recorded and you'll be able to also look at it later. So, big topic, respecting First Nations data sovereignty in the institutional research data environment. Overview, kind of ironic given I've got 7 minutes, but let's do an overview. I want to talk about FNIGC as a place where First Nations have organized at the national level around data sovereignty. We're going to talk about data sovereignty. Of course, a little bit about the First Nations principles of ownership, control, access, and possession. I have to say it's the 25th anniversary of those principles. 2023, so we're very excited at FNIGC about that. And then we'll shift gears to talk about research and information governance and the level of institution and some thinking on how First Nations are asserting their collective rights to First Nations data sovereignty, and how people such as yourselves who are putting together these strategies and plans can understand and respect those collective rights. So FNIGC in 1 minute. FNIGC has been around since 2010, but our roots are much, much older. Back in the mid-1990s, the federal government was doing some socioeconomic surveys, data collection across the country, and ignored and did not consider First Nations and Northern Indigenous communities. That leadership got together and said, hey, we need this information. We want evidence-based policy making for our own communities, our own governments. We want that collective asset of quantitative knowledge, and developed and designed their own surveys, and those are still going strong. So that went from a loose committee structure to the National Information Governance Center that we are today. And one of the reasons I mentioned that is that practical experience of field work and working with individual community members, families, chiefs and councils, other organizations at the community level really informed the development of the principles of ownership, control, access, and possession. So these are big thoughts about governance and self-determination and sovereignty, but really, really also grounded very much in the reality of trying to do this work in a colonial state. So our vision is that every First Nation will achieve data sovereignty in keeping with its own worldview. The only thing the main thing I want to point out about our mission and how we work is that, as a national organization, and I'll mention this again in a moment, as the stewards of the First Nations principles of OCAP, not the owners, certainly not the police of them, we work through regional and national partnerships. And really, I think, we deliver and design and collect data with First Nations. And we also try to inform and shape how conversations around information governance are happening at the level of policy and frankly, kind of social norms and institutional norms about these things. We're not a political organization. We don't speak on behalf of any First Nations. We're not a government. We're an advisory body, support body. And I think it's true to say we try to speak up in these conversations and participate in them through partnerships. So data sovereignty, what is it? Well, let's talk about what First Nations data is. And it's probably easier to talk about what First Nations data is not. First Nations data is any data or information from First Nations. And we think of that as data or information that is specific to First Nations lived experience and culture, language, culture, stories, songs, ceremonies. And in this day and age, data takes so many forms. I think it's important to stress that that's physical information, as in regalia, but also the digital forms that related information comes in, the metadata, that kind of thing, data about First Nations that you may be more familiar with, many of you in your work. This would be more typically quantitative data, demographic data, administrative data, data about health, housing, education. Also really, really important to acknowledge that this is First Nations data is any data or information from First Nations territories or even about First Nations territories. And that includes the lands, the waters, the medicines, the swimmers, the flyers, all the four-leggeds. So that's a lot of data. And where is it? Well, very often, much of it is not with First Nations themselves. I think this is not a difficult concept to understand, although of course we see how challenging it is and how many barriers it puts up to First Nations. Indigenous Services Canada alone holds over 200 databases, and I know many of you are working in research institutions, not just universities and colleges, but perhaps research hospitals and those kinds of things. You are all clearly holding First Nations data, and the work of OCAP is really about exercising First Nations collective rights over that data wherever it may be held, including in your data sets as researchers and as your legacy data sets in your archives and records. So data sovereignty. Well, there's two aspects here, data and sovereignty, but we're knitting them together, and it's really the right, and that's an inherent Aboriginal right, but also in Canada, a constitutionally protected right under Section 35 of a First Nation to exercise authority over its data and information. And over the past couple of decades, globally, Indigenous movements worked hard to create the UN Declaration on the Rights of Indigenous People, which went through several iterations. It's now been ratified by or signed onto by Canada. And last year or the year before, the UN Declaration Act was signed by the Canadian government, meaning that Canadian laws now have to align with Canada's commitments to First Nations, Métis, and Inuit people under the UN Declaration. And while data sovereignty may not be a named right in that declaration, the right to self-government is very clearly articulated. The right to institution building to support self-government is very clearly articulated. And I think it's a no-brainer to say any society or government needs data and information about its own citizens and people and lands in order to be self-determining and have those institutions. So that brings us to OCAP. So since 1998, OCAP, these principles have been the primary or major main framework lens of thinking for First Nations in exercising these collective rights. I won't go into them in detail here. There's lots of opportunities for you to learn about them if you're not familiar with OCAP. We have our online course. We have lots of literature and information on our website. But I want to point out the bigger picture of how they work. So at a minimum, there are standards for the collection, protection, and use and sharing of data, First Nations data. But they are more than that. They are actually an expression of desire for research to provide active benefits to communities and not only mitigate harm. So typically, Western mainstream ideas around ethics and the management of data are about minimizing harm. OCAP is really saying, that's a minimum we're beyond that. It needs to be about capacity building and benefits for communities and governments, First Nations governments. And clearly this is tied to self-determination and the preservation and development of culture and community knowledge as a collective asset. So data management plans, data management strategies. I want to shift gears now and talk about the challenges and maybe hopefully the opportunities that Tri-Council policy, Tri-Council guidance. I want you to remember that these initiatives are part of a broader Canadian attention to data management that one could say is geared towards the opening of data so that Canada can be competitive in terms of research and innovation and economic development internationally. But that said, First Nations, and I know Métis and Inuit nations as well, for years have thought of data management as a no-brainer. Data management, the stewardship of your collective data assets, is integral to doing any sort of research. So it's a little bit ironic now that over the past couple of years, ISED and the tri-agencies and other arms of the Canadian government are putting this emphasis on data management, because it's something that Indigenous people have been doing and wanting the government to give back their capacity to do for a very long time. So I digress a little bit. At the institutional level, we see First Nations and Métis and Inuit data going down a long hallway and encountering lots of different doors: research services, research ethics boards, IP, offices of commercialization, RDM, which we're focused on here, the data and the barriers to accessing funding through the grant system, student data, First Nations student data about attainment and enrollment, staff data, and then of course any of the information that's attached to the protocols that tribal councils and First Nations increasingly have with colleges and First Nations in their territories. So the point I'm getting to is that many of you will have responsibilities in developing data management strategies or data management plans. And I would encourage everyone to look beyond that lens to say First Nations will see their data and information in a more holistic way. And that long hallway with all those different doors, that's sort of your problem in many respects, the barriers in your own institutions. And that needs to be accounted for in your dialogue with First Nations. So we've got an example here. Research ethics boards in the universities will deal with First Nations, perhaps directly, probably indirectly. Researchers themselves, the guidance that comes from the Tri-Council, and then various offices of VP Research Services. First Nations are encountering a much more daunting ecosystem here institutionally, which I touched on a little bit before. I think I'm running out of time here. So all of this to say that this is about the assertion of collective rights. And First Nations, as rights holders, as Métis and Inuit peoples are as well, are asserting those collective rights over their data. And as members of or representatives of non-First Nations institutions, your role is to understand First Nations collective rights here and to give space for that and to respect those rights. And it's also about being aware of the challenges First Nations face in terms of this long hallway and the way funding flows. We have funding that flows to the tri-agencies. We have funding that flows to individual institutions. We have funding that flows to the Digital Research Alliance of Canada. And all of you guys are playing different roles in terms of setting up expectations, policies, templates around here. That's too much text, but let's think of it this way: getting the house in order. I think First Nations, and I'm sure Métis and Inuit, want to know, what are you doing inside your institutions to make this process transparent, to make it dialogical and collaborative, and to make it to give First Nations researchers themselves and community members who are being approached about research every opportunity to participate in the development of these strategies and plans. I've probably gone over a little bit. I know you've got lots more to talk about and people to hear from, so I'll end it there. Please reach out to me if you'd like more information. I think this is an important opportunity for research institutions to right some long time difficulties in the way data is managed. Thanks very much.
Thank you again. Now I have the esteemed pleasure of welcoming Dr. Wayne Clarke. Dr. Clarke is originally from Churchill, Manitoba, and is a registered Inuk from the Nunavut Agreement. Oh, Wayne, I'm not going to try to say that because I don't think I can do it right. He is the director of the Waakebiness Indigenous Health Program at the Faculty of Medicine and Dentistry at the University of Alberta. From 2013 to 2020, Dr. Clarke was the director of the Indigenous Health Services for the Winnipeg Regional Health Authority, overseeing Indigenous language interpretation, discharge planning, and patient advocacy for Indigenous patients within hospitals and other healthcare facilities. Dr. Clarke is a board member and treasurer for the Canadian Society for Circumpolar Health and a fellow of the International Arctic Science Committee Social and Human Working Group. And his research interests include Inuit health, digital health, and Indigenous medical education. I want to welcome Dr. Clarke. I don't know why my computer's doing these funny things to me today. Trying to end. There we go. And there you go. Go ahead, Wayne.
Oh, thank you. Thank you so much, Angela. So I will just share my screen here so I can. Oh, that's the wrong one. My goodness. Okay. Okay, here we go. It should work. So you can see this now, yes? The PowerPoint?
Yep.
Okay, great. Okay, so, right. So I'm going to be talking about Inuit research and data sovereignty. And I'm conscious of the time as well, so I'll go through this as quickly as I can. Key messages, we know about the historical injustices. So I don't need to get into that, but I do want to mention that a lot of the data that is held is within federal and provincial systems, and we don't have access to these. And it does make it very, very challenging for us as communities to access this data. We often have to work with research institutions who gain access to this. And there are still challenges between jurisdictions, like with Nunavut, and we've had cyber attacks there. There's a lot of fear around accessing personal health information, even from an individual standpoint, and how do we look at, making improvements, knowing that we can do so with data, and how can we do that from a sovereign lens. As I mentioned around the data that's within systems, we looked at cases specifically within Manitoba where we know that there are 15,000 Inuit who come to, or 15,000 instances of Inuit travel. So maybe not 15,000 Inuit, but these are statistics that we know we've been able to access this through administrative data. And also the significant amount of transfer payments that goes to the provincial government for health service delivery. But there's no mechanism, there's no identifier within those provincial health systems to be able to track that data more specifically. So we wanted to look at how can we develop a tracking mechanism, at least through research, and potentially, in tracking Inuit service utilization is ultimately what we want to look at as the work that we're doing unfolds. So our first project was the Quananixuartikiksact project, and this project was a 5-year study that we completed, and it was developed in consultation with our Inuit elders through the Asamitit Siviakti, and these are well-known elders within Nunavut, all across Canada, and so all of the study design was approved by the Elder Council, and we basically looked at those, how to work with the data that's stored, whether that's administrative or how we could use anonymized aggregate data, and working with the Manitoba Centre for Health Policy to look at creating data sets that can give us what we needed exactly. And that was for Inuit that came to Manitoba and also Inuit in Manitoba who participated in the study as part of the association in the province. And so with outcomes, so we had a lot of data, which basically identified all the hospitalizations, the length of stay, demographics. It told us the program that someone was in, so they wouldn't necessarily know what their health concerns were or their conditions, but we did know which program they were in, so surgery or internal medicine and so forth. So we could see length of stay, and also repeat, hospitalizations, as well as one area that we were able to see was like women's health, so women that were coming for birthing. So we knew specifically around that, and there's been a lot of evidence around, studying why women leave the north for birthing, as well as mental health, but not necessarily any sort of diagnosis, but just when there was more acute levels of mental health and when they went to a specific health center in Manitoba. And then we were able to look at all of that data and compare it to sort of the Manitoba rates for those same indicators. And we saw those variances, which were, of course, concerning. We did look at the other rates of rural and remote areas of Manitoba, and we saw that there were also disparities between the Nunavut patients and the Inuit patients and those other categories. Without getting into the actual quantitative results, I wanted to define that because then it helped us work with community members to identify how do we want to make improvements based on that data, based on the evidence. It was their rationale for identifying what other kinds of supports could be leveraged in terms of the Indigenous supports that exist. And the Indigenous supports that existed within the Manitoba healthcare system were First Nation centric. And so then we created basically a method that could help us look at administrative data sets to track COVID-19 infection rates. So by having at least some exposure to the health system, working with various agencies, we built a case for having an identifier and diagnostic tests. And so due to H1N1, the issues that were caused in First Nations at that point in time, an identifier was incorporated into COVID-19 tests. And then we were able to use that same method and approach from First Nations. And then that gave us that ability to track Inuit obtaining tests during the pandemic, which proved to be extremely valuable, not only for our community, but for jurisdictional reporting between Manitoba and Nunavut. So I just took a snapshot. This is a summary as of June of 2022. This data is still being tracked, but you could see there was like cases at that time, new cases as of June 17th were reported, and there was 112 active cases, and we knew about 974 fully recovered or fully vaccinated, and who was, where there was the majority of tests being provided, and the third dose at the time, the third doses that were administered within that data set. So that was super helpful to be able to track that on a provincial scale. But it was as a result of us mobilizing to say we have a role in our data and how we want to be able to use it, and also to make decisions as part of decision making that was, say, occurring at the at tables pertaining to public health. So then we have something called Inuit-Kayaahk. Inuit-Kayaahk has been used to help form policy and programs, particularly in Nunavut, as Nunavut was formed. And it helps with community decision-making at a micro level, but it's also been blown up at a macro level. So it's an excellent framework for not only research conceptual design, but how to involve elders and other community members. And these are the principles of Inuit-Kayaahk, and they are similar to what we might see in other Indigenous communities that use principles, but these are, of course, very specific. And they're definitely to support where there's consensus decision-making, or where there's like, a foreseen challenge that may be coming on the horizon. And these principles were used during difficult times, during famine and very challenging times where there could have been significant decisions that need to be made for survival. And so they are still used today. We're trying very hard to get these incorporated into programs that are specific to our needs. Other considerations relate to how we can ensure that we do research design in the first place and when it's necessary. And then just final thoughts, we were able to use both quantitative and qualitative data, and use interpretation of data by elders, and using IQ, and then wanting to use research outcomes to support innovation and quality improvement in the healthcare system. So thank you, and I had to really burn through that. I think I did go over, and I apologize for that to the next speaker, but I want to thank everybody for their attention.
No, thank you so much, Wayne. That was fantastic. I really appreciate that. I always call it IQ because I can never say that. So it was wonderful to hear you say it for me, because I know it is IQ and I do watch it, but I'm not an Inuk scholar and I don't know those words very well. So
I probably can't say Mohawk words either. So yeah.
Thank you so much.
My pleasure. Thank you for inviting me. I was so delighted to be able to share with this audience who has an interest in this area. So it's always good to be able to talk to like-minded folks.
Thank you so much. Okay, well, now I have the pleasure of welcoming our next speaker, who is Dr. Bobby Henry. He is Métis and a citizen of the Métis Nation of Saskatchewan, and is in Prince Albert, Saskatchewan. His research focuses primarily on the experiences of Indigenous people engaged in street lifestyles, where he uses a survivance lens to challenge pathologized understandings of their experiences. Much of his research consists of using an Indigenous research framework focused on relational accountability through arts-based research methods, working with Indigenous ex-gang members, and collecting life narratives using visual research methods. He examines how their notions of identity are impacted with their involvement with multiple social systems. So I welcome you, and I hope that you can get on there. There you are. I was trying to find you. All up to you now.
Perfect. Okay. Let's just start this. All right. Thank you, Angela, for this. And hello, everybody. It's a pleasure to be here to speak today. And I'm just going to go over what we're calling the Métis Nation Saskatchewan data governance principles that we've been working on here for the last number of years and so forth. So, but before I begin, I just got to move some stuff around my screen here. I want to recognize Dr. Caroline Tate for her work on the principles being talked about today. She was one who was leading this about 7 years ago when we started to work, and I'll talk about that a little bit more as we move forward. I also want to recognize Dr. Chelsea Gable, and it's through our discussions on the continued concerns that we see with Métis health and well-being research and research overall that a lot of the discussion I'm going to be bringing out today and highlights. Finally, to the partnerships with M&S, specifically Health Minister Mark Friesen, who continues to support our work and strive in the development and leadership in Métis health, data and sovereignty. So one of the things before we move forward here, or what I'm going to be talking about in the next 6 minutes now, is that there's a lack of actual good data on Métis peoples and issues. As a result, we don't have a strong understanding or knowledge related to Métis data, what's going on in our communities. We have very good data at local levels, but we don't have a large sense going across different spaces or large research sets. There were supposed to be specific Métis calls coming out through CIHR, however, that hasn't happened. And for a lot of times, Métis data is just subsumed underneath Indigenous or brought out under First Nations data when we utilize the term Indigenous. So much of this is a result of the ways in which Métis people, though, have been organized, which is usually under self-identification categories. And this has had a really detriment to Métis data collection. Because when we look at the idea of self-identification, what happens is that anybody with these misconceptions of who are the Métis in Canada, individuals see this as a mixed race, and therefore, and not as a distinct Indigenous group within Canada. So when we look at this, we have our own identities and values, language, cultural traditions. An individual is somebody who self-identifies as Métis, distinct from other Indigenous peoples, historic Métis Nation, and is accepted by the Métis Nation themselves. So when we look at this, we're also seeing there's 5 provincial regions. So we have the MNBC, MNA, MNS, MMF, and MNO. And then they all fall underneath the MNC in of itself. And citizens, and now we're starting to see a stronger need from the different provincial governments, provincial bodies, to start doing specific programs and specific research data collection for their citizens. And this is where I think we need to start seeing and looking towards a distinction citizens-based sort of research approach. But what does this actually mean and what's happening here? So when we look at this, we see a big push at different levels for distinctions-based research, data analysis, and to shape policy. So we need to look at the prioritization of what needs to be researched by Métis people, actually addressing Métis communities and concerns. We need to look at continuous and sustained input from Métis leaders in their communities and increased oversight by Métis people. So when we see this, there's a lot of opportunities to grow in data management, but it has to be done in a good way. It has to be done in a way in which Métis people's communities and political bodies or governing bodies have the information that they need in order to develop proper policy to improve the life and well-being of their communities. So this whole project of the data principles began out of a project partnership between the Métis Nation Saskatchewan, First Nations and Métis Health Services, Saskatchewan Health Authority, and First Peoples, First Persons National Research Hub, and the Canadian Depression Research and Intervention Network with CIDRN. Where this came from was here in Saskatchewan, they were looking at issues related to surgical wait times. But again, we could only really collect First Nations data through uninsured health benefits. And they were trying to understand the impacts that this was having within Métis communities, because a lot of Métis people were coming from northern communities down, but we didn't actually have a way in which to track or understand their experiences. And so even though we had anecdotal evidence, there was no real strong evidence in that the experiences were being felt by other Métis citizens, or how broad or the breadth or the depth of the issues that we were seeing. So what happened was our team completed a review of existing Métis specific research governance models, engaged senior governance experts to provide advice to the team, and met with a number of Métis stakeholders in Saskatchewan who had experience with research partnerships to work towards creating the governance model. The team recognized that the intersection and interdependence of this data with other forms of research, population patient-oriented biomarker qualitative intervention, required a more robust approach by MNS in the areas of research governance itself. To address this, the team worked with MNS to create a research governance model for all areas of research. And so when we're looking at this, the governance models, despite being focused within a health systems, is now looking to be applied across all other areas, very similar to the presentations you saw earlier, specifically with OCAP and how the different ways in which research or research projects will be managed or looked at building partnerships. So when we look at establishing the Métis specific research governance principles, the model aims to be responsive to the needs of diverse Métis populations. This means rural, remote, and urban. What we are understanding with this is that just like First Nations and OCAP, it shouldn't be a pan-Indigenous. When we look at Métis specific or the principles, these are looking at to be broad enough to start developing specific relationships, but also localized to specific issues or relationships that are also happening within those communities. So the tools are supposed to serve as a tool, or the principles are supposed to serve as a tool for Métis communities, organizations, and groups to facilitate research processes more effectively and efficiently, thereby attracting researchers and funding to areas of research that are prioritized by Métis people. When we see this, in the end, there are 6 principles that are being put forward here. And it's utilizing the infinity sign that when we look at the development of these principles, it's within a reciprocal relationship. And it's supposed to be an ongoing relationship that continues to build as we move and shift through the different principles. The principles are also designed, as was stated before, that we're looking at as a living document and as we move through these processes. So the first principle is building reciprocal relationships through meaningful and authentic engagement of research partnerships, respect for individual and collective autonomy, identity, personal values, gender, confidentiality, practices, and protocols across the research and knowledge mobilization process. The third principle is safe and inclusive environments that are culturally safe and include diverse Métis voices and perspectives. The fourth is diversity that extends the idea of safe and inclusive environments by recognizing the diversity of Métis perspectives and lived experiences that can influence the design of research relationships and their processes. The fifth principle is research should be relevant to Métis people involved in it, requiring community partners to identify research that they want to undertake. And finally, the sixth principle is Métis context requires researchers to be familiar with the history of Métis people, specifically the local history of the community and organization that they are conducting research with. Understanding data stewardship requires a clear legal statement and agreement to ensure that Métis stakeholders retain sovereignty over research processes, data analysis, and knowledge mobilization. Research agreements establish how Métis rights holders are informed, consulted, involved, and collaborate in the research process, from the establishment of research questions through to knowledge mobilization, disseminating research findings, and into publications, policies, and interventions. And this is the one part that I want to highlight here as well. Why we're using stewardship is that nationally there is no real infrastructure put in place at the moment. And so this was where the idea of stewardship really needs to be understood between researchers, universities, funders, until MNC and the different provincial bodies begin to have the proper infrastructure in order to house their own data. The principles are moving to the MNS Legislative Spring Assembly to be ratified within their constitution, which will then be used to frame the National Métis Research Strategy. So this is moving forward. It'll be ratified. And so any researcher looking to conduct research with Métis communities will be having to go through these guiding principles. So in the end, self-identification, Métis and health data collection there's a lot of inaccuracies, which leads to severe lack of Métis-specific health services and programs. Identity politics is complex. When it comes to health research and policy, citizenship should be the primary identifier for Métis people, is what we keep hearing. Health researchers need to become fully aware of the impacts on Indigenous categories when conducting research and moving into this idea, the era of co-design with distinctions-based research. And finally, the 6 principles are designed to improve Métis data sovereignty with Métis peoples, communities, and governments. And so with that, I will end that there and hopefully didn't go over too much. So thank you. Angela.
No, you did a wonderful job. Thank you so much, Bobby. I truly appreciate that. And hearing about the 6 principles is especially important for everyone to understand that. Again, just hearing from Aaron, Wayne, and yourself, you can start to see the distinctions-based principles of doing research with different groups. So now, finally, our last speaker, and another friend of mine, and I'm very grateful that she took the time out of her day to come help us, Dr. Jennifer Walker. She's a member of Six Nations of the Grand River and an associate professor at the Department of Health Research Methods, Evidence, and Impact at McMaster University. She has her PhD in community health sciences with a specialization in epidemiology from the University of Calgary. She currently holds a Canada Research Chair in Indigenous Health Data and Aging. I want to warmly welcome Dr. Jennifer Walker, and Jen, I'll leave it to you to take away from here.
Sounds great. Thanks so much, Angela, and to Bobby, Wayne, Aaron, and Wendy for all the words so far. I'm really excited to be part of opening this important national dialogue. I've been part of our research data management working group at McMaster University for the past year or maybe more, I think maybe more, in preparing for our own institutional strategy. And I think that this is a really important conversation to be having at this critical point as institutions are thinking through their approaches. So I want to just take a minute for me to reflect on the kinds of things we've been hearing from First Nations perspectives, Inuit perspectives, Métis perspectives, and that overall thread that we're seeing of the collective responsibility that Indigenous nations and organizations have for their own data, that they need to be involved in decision-making about how their data are used, collected, stored, accessed, to ensure that they not only have governance of the data in the process, but that the data also can be used for governance. So it links that self-determination and sovereignty. We keep hearing those words. It also expands our thinking from individual consent and management of data driven by individual consent to ideas of collective consent and the responsibility that both nations and organizations have and researchers and institutions have to make sure that that collective consent is embedded in ways that are grounded in local knowledge and approaches and that are relational. So the roles that I'm hearing and that I'm thinking about that of the institutions are to give space to understand, to respect, to listen, so that those plans or the overall strategies that institutions have give that space and promote that understanding of the diversity, to understand the complexity and the need for distinctions-based approaches. We heard that Métis best practice for Métis data is not self-identified data. We just heard that. So, you know, we really need to be listening as researchers and institutions. And then those institutional strategies that make that space for diverse Indigenous data governance practices, that will be integrated into individual research data management plans. So it's really important because the thinking at each institution will guide the researchers at those institutions, particularly people who haven't had a lot of experience so far. So each researcher then will take up that responsibility to ensure that their research data management plans for each project are grounded in those principles and approaches. But those strategies are really critical for setting the tone and making a path. So what I want to just add to the conversation is how this thinking might apply when there isn't necessarily a clear path to distinct First Nations, Inuit, Métis governance. There always, like, ideally there always is, but it does come up sometimes, especially when researchers are collecting socio-demographic information, which is often, you know, self-identification or as part of a broader race and ethnicity variable. So these are kinds of questions that sometimes I get from researchers where it's like, well, we're you know, it's not actually, we're not actually interested in Indigenous research, but we're collecting it because we know there's inequities and we want to make sure that we're measuring those inequities. It happens in like large national cohort studies and StatsCan data collection and so many research contexts. And I want to just put forward that I'd say the principles we've been talking about still apply. It doesn't actually matter whether your intention is not to do an Indigenous research project or not. If you're collecting Indigenous identity as part of a race and ethnicity variable or as part of a distinct variable, these principles still apply, and we have to have the hard conversations and think about the complexity that introduces to research projects and data systems. So there are some published guidelines and principles that can help to ground and guide these discussions. An example is the CARE principles for Indigenous data governance that highlight principles for going ahead with any kind of data that's been collected about Indigenous, any Indigenous data, that as particularly, like, obviously you would go to the individual principles for the nations that you're working with, but if in doubt, then there's some sort of, you know, background principles that can help you think through things and institutions think through things. In general, data that exposes inequities also has the potential to exacerbate and deepen inequities. So we have to be careful, and ways that those data are collected, stored, accessed, and used is critical to ensuring that research at a minimum does no harm, but like Erin said, actually benefits Indigenous nations and people and moves us all collectively forward on paths to healing and reconciliation and decolonization. Thank you, Angela.
No, thank you so much, Jen. I hope everybody got a chance to have a great discussion in the rooms and got to share things amongst yourselves. So really, this was an opportunity that we thought would be helpful for you and useful for you to be able to talk to others about what you'd heard today. Jen talked about the CARE principles, so collective benefit, the authority to control, responsibility to share how the data is used while you're supporting Indigenous people's self-determination and their collective benefit. We've talked about the ethics of data and the primary concern over the ethics of data, and that's what the CARE principles talk about. Wayne, Bobby, and Erin all talked about the idea of how you include Indigenous people. So nothing about us without us is one of the mantras that I want all of the universities to be thinking about. How do you get this included into your research strategy and then specifically into data management plans? And I just want to share a couple of thoughts, some tips, some pointers with you. that all of the DMPs should include information on First Nations, Métis, and Inuit research codes, not Indigenous in a pan way, because I think that there's nuances even in First Nations, Métis, and Inuit, which I heard clearly from all of our speakers today. But I want to make sure that you're thinking that way. And in fact, in the National Institutes of Health Research in the States, they actually say that all DMPs should include information on how you're working with First Nations, Métis, and Inuit research codes or protocols and how you're going to adhere to them. So that's another piece, is the accountability or adhering to things, and documenting that the DMPs are seen and approved by Indigenous communities or organizations, so that it's not just you putting in your REB or your data management plan, but rather that you actually have this all established, and that you're making sure that there is a data sharing agreement or other tools that you may have in order to ensure that you're following the research guidelines. And then finally, National Institutes of Health have also said that they expect or anticipate that researchers will implement Indigenous requirements and preferences on data management and sharing to make sure that First Nations, Inuit, and Métis peoples' lands and resources are protected. So I believe I heard that both from Bobby and Aaron and Wayne. They were talking about, don't forget, the data isn't just digital, but it includes our languages, our cultures, our knowledge, our stories, our songs, our ceremonies. And it's really important that you do that, and that we have different management strategies. IQ for the Inuit. Bobby was talking about the Métis principles that are being established in Saskatchewan, and Aaron talked about what FNIGC did. And Jen did a wonderful job of kind of wrapping up if you had any Indigenous data that was in your bigger data set and how to approach that. So we are going to post this video online, and we will put any resources that you either share with our team or that have been shared with you alongside the video, so that you'll have places to go. I understand that this is not a concept that you probably work in every day. And we know that the universities all have to put in their research management strategies by March 31st. No.